Okay, so just an introduction for those listening. My name's Andrew Wolfe. I'm a plastic surgeon in Denver, Colorado. I'm a primary investigator for the Motiva FDA trials. Motiva implants were very recently approved in the United States, and I'm delighted to have the founder of Establishment Labs and the current CEO, JJ Chacón, who's taken time out of his whirlwind schedule to discuss his implants and his company with us. So welcome, JJ.
Thank you, Dr. Wolfe, and we very much appreciate this opportunity. It's always nice to be able to have a conversation around technology and how it can impact your patients in the most positive way.
Excellent. And so these implants, right, even though these are new to the US, this is not a new device worldwide. And tell me a little bit just about the history of the company and the implants.
Well, I happen to come from a family of plastic surgeons. So, although I was trained as an economist, I was very much aware of the limitations in technology in breast aesthetics and breast reconstruction. And eventually, actually 20 years ago this month, I made a decision to start a company to completely, innovate this space, because I saw these big incumbents and realized they might be leaders in the market, but they're not leaders in technology. And most importantly, they're not leading in women's health, which is what we care about. And, since then, we've been putting all of our efforts, our investments into creating next generation technologies. So we're always coming out with, innovative ways of addressing patient needs. And of course, always with the plastic surgeons.
Excellent. And so when I was down in Costa Rica, I've been on there twice now. You talk about Femtech as a concept, as a real ethos for your company. Can you explain what that means to our listeners?
Yeah, of course. So Femtech is a concept that basically, to me, it means Women's Health 2.0. It means, technologies that can improve women's lives. And the traditional term of women's health was more about reproductive health. Femtech is more broad, is about well-being, is about, how you live your life. It's a lot more inclusive. So that's why, we talk so much about Femtech, because it brings in the technology and the fact that we are doing this to improve women's lives. And
so you view this as more of a paradigm shift in the marketplace, right?
Absolutely, absolutely. Because when you think about like what Femtech does, is it also incorporates women into the decision-making process with the right specialist. And this is something that, through technology, you can do it so well. And, when we talk about our technology, what we are really talking about is, the communication between the plastic surgeon and the patients and how technology can improve options and better address their needs.
And in looking through, you guys are a young, aggressive company. You've got a much more, I think, media savvy approach than, Johnson & Johnson and AbbVie and the other companies that are big players in the space. Is that intentional? Are you focusing this? It seems that there's more of a direct patient outreach on your part than what we've seen historically.
Well, the thing is, if you're creating Femtech, you need to have a conversation with, women who are choosing, to go for a breast augmentation, but also with women who are not choosing to do so. We need to understand, what is it that we're not doing for them? So a lot of the communication that we do is also to listen. And that allows us to, create next generation technologies. For instance, outside of the United States, we recently launched a minimally invasive program. And we did that by listening to the women who were not choosing these devices. And that's fundamental to it. Now, we do it in a way that also can give them information, because patient education is something we believe in. But at the same time, we believe that the plastic surgeon is the best equipped to bring that conversation to a different level, one in which expectations from the patient are brought into the arena of the clinical. And that's why we work with, specialists like yourself.
Got it. And so let's talk about the implants. So congratulations, right? You've outlined really what some of those hurdles are. And we don't have time to get into that today, but the FDA is certainly the most onerous accreditation that you can get, correct, compared to the worldwide approval?
Yeah, it is definitely the gold standard.
And so talk to me about what are, I'm obviously familiar with the technology, but for those who may not be, what would you consider the few differentiating factors of Motiva implants?
Well, the first thing I think we have to talk about is the genesis of these implants. We truly reimagined the implant completely using technology from this century, which is not the case for so many out there. And when we did that, we wanted to create two very important foundations. One, the foundation of the implant that we call the monoblock, meaning having all the components of that implant really work together. And that allows us to have such a strong implant that, in the FDA trial, when we see the rates of rupture, they've never been seen before. Then, the other part is the surface technology. We wanted to create not something smooth or textured, something low inflammatory. So we created a surface technology that allows for a positive cell interaction. And that's kind of like a cell-friendly response. And that's why, again, in the US clinical trial, you see rates of capsular contracture that, are unheard of. Why? Because the body is accepting these implants in a much better way. And, we often think about capsular contracture, which is, the extreme of it, but also it's day to day having nice, soft breast, like real breast tissue. And that's what we strive for. So, on the back of those two foundations, what we have done since then is, bring about other innovations. One of them is the ergonomics implant, an implant that is, basically more comfortable. That implant, adapts to your movement, and that makes it more natural. But also in day-to-day activities, women talk about this, especially women who used to have another implant and then for some reason have to have a revision. They say, this is so much, more comfortable. I'm hugging my friends again, all these positive things. And that's what we are about.
Excellent. Yeah, and for me, I've been very enthusiastic in onboarding these implants into my practice. It's been a fairly wholesale switch over to patients who are appropriate for it, which is a pretty broad range of patients. The thing as a surgeon that I'm excited about is the behavior of these implants when they're not beneath the muscle, right? Historically in the US, we've been hiding implants beneath the muscle because they don't look particularly natural or feel particularly natural above the muscle. And then obviously the capsular contracture rates that you referenced were much higher, or at least in the FDA trials for these other devices, much higher above the muscle. And the fact that Motiva implants with that 4-micron surface are the same above and beneath the muscle now means that we're freed from being subpectoral all the time. And so animation deformity and the significant discomfort and the loss of the pectoral strength really are I think, going to be transformative for the market. And am I correct in saying that the rest of the world has really embraced implants above the muscle to a much higher degree than the US, correct?
Well, I think you bring about a very important point, which is, in the past, I would say that technology was not, working in surgeons' favor. So they had to, be very creative and hide these implants behind the muscle so that they would have, less complications. And now with this technology, what it allows is, when and if possible, put the implant above the muscle. And that, of course, is such a much better way. God put the breast on top of the muscle. So if possible, let's keep it there. That it also, allows us to, give that degree of softness and the natural movement. Also, when you put implants above the muscle, you can get the same appearance in terms of, 2-3 cups up without having to have such a big implant. So, not a lighter implant, but a lighter breast. And those are all positives for women.
Agreed. And when you look at the international data, because obviously the UK and Asia, they've had these implants for much longer than we have. The trends that you see in those publications were smaller implants over time and a trend to going from beneath the muscle to above the muscle. So it's, hopefully we can accelerate that timeline in the US by looking at that OUS data.
Yeah, no, absolutely. And I think, in the international market, we've been there now more than 14 years. And, everything that we see in the numbers in the US clinical trial basically matches our experience in the last 14 years in the international market. But more importantly, beyond the complications is what it brings about in terms of new options. So, if you put an implant above the muscle, again, you can resort to smaller implants because you do get a very nice volume, and that's something that women like. And you get away from, problems related to what you mentioned, animation deformity, having, the muscle weaken over time. And I think that's important for women who are very active, who are going to the gym. It gives them these new options.
Excellent. There is technology that you have available around the world that is not yet available in the US. Are you looking to bring some of these less invasive, the Joy, the Mia, into the US? And if so, do you have a timeline for when that might happen?
Well, of course, I think that, one of the great things from, the FDA approval is that now we're truly opening this super cycle of innovation in breast aesthetics and reconstruction. So over the next few years, we have a lot of things coming. The approval of the reconstruction indication for Motiva implants is something that we want to see, of course, because we care a lot about breast reconstruction, and it's part of of the journey of many women, unfortunately. But we are there for them if that is going to happen. And then, in terms of aesthetics, absolutely, we're bringing our, next generation ergonomics 2 into the process with the FDA. And once that is completed, that brings about, amazing things like minimally invasive, and that is more for women who, are not so interested in breast augmentation. They're more thinking about, I'm using padded bras and be uncomfortable. Maybe I can do something about that. And I think in general, we just believe that this field is so ripe for innovation. We need to provide, the best surgeons with the best technology.
And I think I've been at various times a consultant for all the manufacturers available in the U.S. As I am with you guys now, and the degree of innovation and the willingness to push the envelope and be creative problem solvers. Like you're a disruptive company in a way that these other companies really aren't. And I'm excited that you will explore the market, find something that's lacking either in the patients we're serving or the way we're serving them. And you and Roberto and the team will simply figure out a way to solve the problem, right? And if the right implant doesn't exist, you guys can fabricate it. And that's exciting. You're exciting to work with.
Well, thank you for that, because that's exactly what we like to do every day. I spend my week here in that headquarters, working with the different teams. And one of the things that we talk about is, not that have chosen to undergo a breast augmentation, but also those that, would like to have one, but they're just not finding the right mix for them. And we're always, testing the market, looking at different options. Definitely that, coupled with the communication that we get from the plastic surgeons like yourself. I mean, you've given us so much great information throughout, the last few years since, the trial began. Your feedback, we take that very seriously. And I actually wanted to thank you for that, because you've been super helpful to us, and also one of the most prolific investigators in our U.S. clinical trial.
Well, thank you. You guys are a privilege to work with, and it's the back and forth that it's different from what I've experienced in the past. And you give advice that is actually acted upon is rewarding for us, because normally we feel like we're talking to a wall when we ask for things from these bigger companies. And so I think it's, an excellent partnership, and I'm excited to see where you guys take it. Do you have anything that's sort of pie in the sky down the road that you can touch on theoretically?
Yeah, I actually can mention something that I find super exciting, and I think it's going to fill a void in aesthetics in general. And it's we are bringing our minimally invasive program into contour aesthetics, particularly into gluteal ergonomic modeling, which is what we call it. So women today that are seeking to enhance basically their buttocks, they don't have that many options. And what we have seen is that, there is a lot of interest in that indication, but there isn't a lot of things that make women comfortable in to go for it. So, this program is called GEM. It's in its second phase of the clinical trial, and we're very happy with the first phase. Received amazing comments from women who participated in the trial, and of course the surgeons. And now we're in the second phase of the trial. And as we bring more women into it, I think we're just super happy, and we hope eventually to see this technology approved in the international market, and of course bring this to the United States.
Got it. Well, we'll look forward to that, and I'm excited about things we haven't even considered yet that you guys are going to find very interesting solutions to. So I will let you go. I know you're incredibly busy trying to basically get the entire world shifted over into Motiva. And you've got a big contingent of surgeons down there. We're having a blizzard in Denver, so I'm a little bit jealous of your Costa Rican location at this point, but I'll be getting down there in the spring, so I look forward to that.
Well, thank you, Dr. Wolfe, and I think, once again, very much appreciate the partnership. We love working with the best plastic surgeons, and again, thank you for the opportunity today. And we're very excited about our entry in the United States, and of course, into your communities and in Colorado.
Well, thank you. I look forward to what we're all going to achieve together. So I wish you congratulations and good luck moving forward, and I'll see you soon.
Thank you, man.
Pura vida. Take care.